In this video, I want to delve a little bit deeper into specific risks and things that can happen to you if you vape. I did a video earlier that kind of broke everything down in general categories, and now I just want to go, like I said, a little more into depth into what it does to the lungs and the heart. So, the first thing on here is chemical exposure. You get chemical exposure if you are vaping, okay? Um, Even if it's just a nicotine vape, you're still going to get chemical exposure from the actual device and the liquid heating up, okay? So e cigarettes release something, it's a mix of chemicals that contain several chemicals, but mainly formaldehyde and acrolein. Both of these can trigger lung inflammation and eventually it will damage your airways. So your airways are very, very delicate, okay? And if you introduce something that they're not used to, they don't like, they're going to become inflamed. So they're going to swell and then they're going to start producing more mucus. This is just, it's something that will just continue and get worse, okay? So eventually you're going to have persistent coughing, you're going to have shortness of breath, and it's going to be due to the vaping. Um, Next, I have respiratory illnesses. So, what I mean by this is that you will be more susceptible to catching respiratory illnesses that are going around. And that's just because your immune system will be down, your lungs will not be as healthy as they need to be to fight these infections off. But also, there is something called vaping associated lung injury. It's VALI. And this is something that can occur at any time and it can lead to enough damage in your lungs to actually cause you to need to be hospitalized for a short amount of time. Next on here, I have popcorn lung. So I don't know if you've heard about this, but this is something that I've just been hearing about maybe within the past couple years. And it is directly associated with vaping. So, what you're doing whenever you're vaping and you're using something that has flavor in it, that contains something called diacetyl, and this is a chemical. So, what it does, it well, actually, you're going to be inhaling it. It's going to get into your airways and it's going to cause permanent damage in there, okay? So it causes something called bronchiolitis obliterans, okay? It's kind of a mouthful, but it is a permanent condition and it is something that damages your lungs airways as well as the structure of the lungs. It will definitely make it hard to breathe and it is something that would make it very noticeable. So now let's look at what it does to the heart. So, just like smoking cigarettes, it's going to increase your heart rate, it's going to increase your blood pressure, it's going to put you at an increased risk for heart attacks, and over time, it can contribute to cardiovascular disease. So, not much different from a cigarette as far as that goes, the effects on the heart. Now, as far as the risk of heart disease goes, you will be at an increased risk for developing coronary artery disease and you will be at a higher risk of stroke as well. So, same as a cigarette, you're going to have all the same negative heart effects as you would with a cigarette and vaping. They're going to be about equal, okay? And then lastly, I have decrease in oxygen supply. So, the chemicals in the vape aerosol can actually decrease your oxygen supply to the heart, making it harder for your cardiovascular system to function optimally. So, just a lot of things to consider there. Now, on my next video, I'm going to do a comparison between cigarette smoking and e cigarettes, or i.e., vaping. So, you don't want to miss that. That way, you can kind of use your own knowledge, education, and you can put it to work. And just remember anything that you can learn about your body, whether it be your lungs, your heart, anything, it is going to help you live longer because you're going to make educated decisions. And that is what it's all about.